All right, so these are going to be the series of mini lectures over STI and pregnancy prevention, which I have in the modules listed as chapters 7 and 18, but I'm actually going to talk about chapter 18 first and then chapter 7. I promise I know how chapters and numbers work, but I think it makes more sense to talk about STIs first and then talk about how to prevent them, and then obviously wrapping pregnancy prevention up, within that same kind of element. So first of all is our categorization of STIs. Now, you've probably heard the term STD, and that used to be the standardized term, sexually transmitted disease. However, now we prefer to call them STIs, or sexually transmitted infections. Medically, there are some providers that'll draw a distinction and kind of have it on a continuum, that it's an STI up until a certain point, and then it becomes an STD, meaning like the infection is active in your system, but then once you have a certain intensity of symptoms or effects, at that point they're labeling it a disease. There's also the stigma component of it, in that disease brings up a very kind of negative connotation just in terms of what word it is, whereas infection is definitely a more neutral term. So there's three key categories of STIs. There's viral, there's bacterial, and there's parasitic. Viral STIs are ones that are caused by a virus. Now, these are ones that are not curable, but there are medications that exist that can help manage the symptoms and the viral load. Again, excuse my dogs. Some examples of viral STIs are HSV, or herpes simplex virus, which is what causes cold sores, HSV types 1 and types 2, HPV, which causes genital warts and then can also cause different types of cervical cancers, and then HIV and AIDS. Now, HIV/AIDS is a continuum, right? It's the same infection, it's the same virus. When your viral load is at a certain amount, it's considered HIV. Once your viral load gets beyond that, it's considered AIDS. And there are medications that can help slow or even prevent HIV from progressing into AIDS. There are also medication regimens that you can take that can reduce your chances of getting HIV if you're with a partner who you know is HIV positive. That's called PrEP, if you ever want to look into that. One common misunderstanding about HSV, or herpes simplex virus, is a lot of people used to say like type 1 is mouth and type 2 is genitals, or vice versa. We've actually found with some better virology research that both types can live in both places. So they're two different strands of the same virus, and either one can live in either place. And fun fact, if you have one of them and your viral load is high enough, you can actually test positive for the other one as well, and it kind of creates a false positive. Most people who have HSV did not today, within like our population, most people who have HSV actually did not get it from sexual behavior. They got it by, it started orally, and most people today, it's as a kid, I unknowingly drank after an adult in my life that had it. So just a little fun fact. And then the bacterial STIs are ones that are caused by a bacteria. Now, these ones can be cured, because if it's caused by a bacteria, it can be cured by an antibiotic. So gonorrhea, syphilis, chlamydia, these are all ones that are caused by a bacteria. You get a test, you test positive, you take a round of antibiotics. For the most part, you're good. And then finally, the parasitic ones. These are ones that are caused by a parasite, and these ones can also be cured. Trichomoniasis, pubic lice, things of that nature. So, some fun facts. I don't know if there's going to be a way to keep myself out of the way. I might just have to move myself around the screen. Most of these spread skin to skin, but it has to be through a mucous membrane or a lesion. Okay, what I mean by that is if your partner has a herpes infection on their genitals and you are doing hand play, right? you are not, if you don't have any broken skin, you're not going to get a herpes outbreak on the palm of your hand. It can't live there. It needs to live in a mucous membrane or in an open lesion. So like if you have an open cut on your hand, yes, different story. But you're not going to get a herpes infection like on your hand. And this is how most of them work, right? You're not going to be exposed to chlamydia in the palm of your hand. It needs a mucous membrane, it needs an open lesion. Some spread skin to skin, and then also body fluids. Now, the reason I designate most is because while it was traditionally thought it only spread through fluids, so as long as ejaculation didn't occur or something like that, that you were fine, it's actually been found that most of these can also spread skin to skin. So the idea of doing things unprotected and then just using a condom right or something is not as protective as what people once thought it was, because again, it's not just the fluids. It can also spread based on that skin contact if you're talking about a mucous membrane or a lesion. So full protection at all points during the sexual encounter is important. Now, these viruses, these bacteria, almost all of them can live on or in the genitals, on or in the anal region, and also on or in the oral region. You can get chlamydia, gonorrhea, and syphilis in your mouth, in your throat. One interesting statistic that we found whenever abstinence-only education had increased, one thing that we saw was a lot more teenagers having oral sex because they're lots of reasons. We'll talk about sex education later in the semester. But lots more teenagers were having oral sex, but a lot of them didn't realize that these infections can spread through the throat. So we actually saw a pretty big increase in rates of STIs, gonorrhea, chlamydia, and syphilis in particular, in the throat, in the back of the mouth. You can actually look up some pictures of what that infection looks like in your mouth if you're curious. Now, some of these can be transmitted other than sexually. I already mentioned with HSV, most people today who have it actually don't have it from a sexual encounter. They have it from drinking after somebody or something, or kissing or something of that nature. And a lot of people got it when they were a kid if they drank after an adult who had the virus. HIV can be transmitted through needles, drug use. And then pubic lice can actually live on towels or on bedding for a significant period of time. So if you slept undressed in the bed of somebody who had it, if you shared a towel with somebody who had it, they can also be spread that way as well. Many of them are transmittable with no symptoms. So the idea that if you don't have symptoms, you can't spread it is not really true. For a lot of people, the bacterial infections will remain asymptomatic for a very long time. And with HSV, with herpes simplex virus, it's actually most contagious before you ever even get a blister, because the viral shedding is at its highest peak before your body even forms the blister. So it's at its most contagious before you even know you're about to have an outbreak. So don't just assume that because there's no symptoms, it's not transferable, because that's not true. Now, some of these are able to live on surfaces for a little bit. We talked about especially like with pubic lice, it can live on sheets and on bedding. But even some of the viral and the bacterial ones, they're not going to live, for days on a surface. The whole toilet seat thing is not really, but they can live on surfaces long enough that, for example, if you were sharing a sex toy, if you had something that both partners were using or was double-sided and you were flipping the sides, things like that, it can live on the surface long enough to go from one person's body to the other. So again, if there's a concern of an STI, make sure there's a pause, clean and sanitize toys. They make some like misting cleaner that's really convenient for that. I can actually post a link to that because I'm all about STI prevention. So I'll post a link to that with this video too. But yeah, so it can always live on surfaces. So be very, very careful with sanitation of sex toys and things of that nature. But that doesn't mean you can get them from a toilet seat. Now, about testing. Positive tests can take up to 3 months to show up, depending on which STI it is. That's why it is so important to test regularly. So if you had an exposure, a broken condom, an oops, a whatever, last night, going and getting tested this afternoon is not going to give you accurate results, because it can take several days, sometimes several weeks for the viral load, the bacterial load to be high enough in the system for it to actually show up on the test. My dog's always in a mood when I record these videos, so I apologize for that. So best practices best practices are, if you've had a sexual encounter that you think could have put you at risk for an STI, test 2 weeks after that occurrence, and then test again 2 weeks later. And you also want to continue testing on a regular basis if there's something about your situation that's not monogamous. Depending on how high of a risk you think that you're at, you probably want to test every 3 to 6 months. Oh, for heaven's sakes. Okay. So now let's talk about categorizing STI prevention and contraception, or pregnancy prevention. I am already at a few minutes, so I'm going to stop that and have this be the end of part 1, and part 2 will pick up with categorizing contraceptions and STI prevention.